Assalamu alaikum, everyone. Thank you so much for being here. I extend my greetings to everyone attending this webinar. I'm Kashmala Khan from 4th year MBBS at KMDC. Today, I have the honor to host this educational and inspiring webinar powered by KMDC Alumni. Our chief guest today is alumna of batch 2008, Dr. Urooj Riaz. Most interestingly, just yesterday, I had the opportunity to compose her interview for Humans of KMDC in collaboration with KMDC Alumni. So before we proceed, I just want to emphasize on her career so far. Dr. Urooj, after graduating from KMDC in 2008, pursued medicine. She completed her FCPS in 2015. Right now, she is serving as Assistant Professor of Medicine at Jinnah Medical and Dental College and Sohail University. She is also Consultant Physician at Fatimiyya Hospital, Sohail Trust Hospital, Aga Khan University Hospital, Medicare Cardiac and General Hospital. Till date, she has 30 plus local and international publications. But I think from my end, this much is enough. There is a lot more, but I believe you will be more inspired if she shares it herself. Lastly, I just want to add that she is a true inspiration for everyone who got married at undergraduate level because she achieved every certification, every publication, cleared every exam, despite being in the same board. I request Dr. Urooj Riaz to please share some more with us. Today, we need guidance and inspiration both from you. Please, Dr. Urooj.
Thank you very much, Kashmala. I hope I'm loud and clear to everyone. Okay, so my introduction has already been very nicely defined by Kashmala. And the things that are more to it, I might be adding it in during my presentation and during my interview session. So I wanted this presentation to be a bit more interactive. So I wanted to have like your doubts and stuff like that. And with that, in the end, we'll be definitely taking questions. So this presentation is all about Road to Fellowship in Medicine and in Medical Research. My credentials are already on the screen and they are already defined by Kashmala very nicely. So I think we should move forward. Next slide, please. So this was our last day. You know, I'm from batch 2008, popularly known as Irfan's batch. So this was our, we did our exams, we were waiting for our results, and we sort of planned a farewell for ourselves there. We were 50 students at that time, and none of us knew that what careers we might be, you know, pursuing and stuff. But right now, like after 14 years, we have 2 to 3 internists there, a consultant urologist, a consultant orthopedician, nephrologist, a plastic surgeon, an ENT consultant, and everyone is in their field and doing a lot, doing great. So I know this time of yours, the 3rd years, the 4th years and final years is a very fidgety time. So that in which you don't know what to follow in future. But as I always say, that let the field come to you yourself. So you'll know that when to, you know, what is the thing that is striking you all. So next slide, please. In today's discussion, we are going to have 3 different sessions. Number one is going to be FCPS 1 in general and mostly FCPS 1 in medicine, because I did medicine. So it's like going to be a staircase towards FCPS 1, which you're going to be pursuing right after your house jobs. The second aspect would be ethics about dealing with chronic diseases, because you know medicine is king of all. So all the diseases are going to be landing up in medicine, and they're going to be chronic diseases. It won't be much easy to, you know, handle them and bear with the patients all the time and to create a good follow-up. So there'll be certain ethics required. And I think ethics at the level of maybe 3rd year or 4th year, we should be aware of what we're dealing with actually. Last but not the least, and I think the most important, and I think the most required, and I think the most wanted, is the road to research in medical field. It's not at all rocket science, and our college has had a habit of developing our research abilities from the very start. The community medicine department has always been very active. In fact, our first researches used to be the ones we did in our 4th year, and then we presented in Lahore at that time. So this is going to be a road to research, and we are going to discuss the pros and cons about it. During my medicine training, I was very fond of whatever I wanted to do. And right after that, in my surgery training, I was very good with my hands. I used to do very much. I thought I was very able in surgery, and I wanted to pursue that. But I used to find these sugars very disturbing, and the LFT is going bad, and the electrolytes not getting managed. And then at that point, I realized that I might be better at dealing with the chronic illnesses of the patient. So can you go back to the previous slide? In the introduction, as you people are from a different generation, like in our generation also, people used to pursue PLABs, and they used to pursue MLEs, but they were a little number. Right now, almost all of you are going to pursue both of them together. But I will give you the advice that I got from my seniors, that always secure your home ground first. Whatever you want to do in your life in future, your home ground should be established, because we don't know for sure that what Pakistan ka jo hamara as a state hamara jo outlook hai wo kaisa rahega aage, with the dollar price going up and stuff like that. It's going to be expensive. The other thing is that COVID struck, so we don't know ki hame visas और this सब चीजों के अंदर matches and stuff we will be able to find, or we'll be wasting our time. So for that, your home ground should always be secured first. See? So CPSP is a firm responsible for the registration of postgraduate doctors. It conducts exam for the post-graduation in Pakistan, all over Pakistan. And the duration of the FCPS training is about 4 to 5 years, and it depends on the specialty that is chosen. The exams that is conducted is like part 1, you have to give as an entry exam, and then you get your residencies. And in the midway of residencies, after like 2 years, you have to give your intermediate module. After you clear your intermediate module, if you want to stay in the specialty, you stay in the specialty, or you move on to your subspecialty. In the subspecialty, you have to have your synopsis there for the research, and then you have to give your part 2. It depends. If you're in a subspecialty, it is of 3 years, and then the main specialty is of about 2 years. Next slide, please. Right after, when you give your MBBS, you are going to be enrolled in your house jobs. House job should be from a PMC registered, recognized institution. And in the very last that you are going to do your house jobs, you might be, right now we didn't face this, but the NLE thing is going on. Depending upon the perspective of the PMC, whether you have to give it your NLE or you don't have to give your NLE, but still you have to start preparing for your FCPS 1. By the time you're finished with your first house job, I think the picture should be clear that what exactly do we want to do in life. So you should start preparing with the aspect of preparing for part 1. Nevertheless, I do want you to enjoy your house job, because this is going to be your first chance to become practically a doctor, rather than being a theoretical doctor that we were before. So after this, then we are going to be, preparing and enjoying at the same time. Preparation of FCPS part 1 does take a bit of a science in there. I'm going to be dealing with that in later slides. So after you get your FCPS 1 done, then you register with the CPSP, and depending upon your specialty, you choose a 4-year or a 5-year training. Next slide, please. The eligibility criteria of part 1 is going to be MBBS or BDS for dentistry, for that matter. 1-year house job is mandatory, like I mentioned before, and a PMC or PMDC registration certificate is mandatory for that. Next slide, please. So after your part 1s can be given in various fields. Right now, less amount of people, they choose general medicine or general surgery as a part of their career. They always want to pursue it in a subspecialty because they are more inspired by them. It's not wrong. But if you're choosing the main field, then your perspective should be a bit more, persistent and more wide. Medicine, surgery, gynae, pediatrics, anesthesiology, pathology, psychiatry, diagnostic radiologies, all these specialties are very good specialties, but it all depends what you actually want to do in life in future. Next slide, please. Okay, the subjects tested for part 1 is going to be anatomy, physio, pharmacology, pathology, general and special both, micro, community medicine. I'll be answering all of these questions in the very last. Okay, and next slide, please. The study material, very interestingly, the things that you've actually studied in your final years and your basic knowledge. So पूरी किताबों को दोबारा से वैसे ही पढ़ना might be a bit tricky for people who are fond of making notes, for people who are fond of making, small things in their own textbook. They might be reviewing their own textbooks, but I would advise them to, have one of the courses like BRS or Snell's or Pathoma, whatever, but just review the basics, because basics are things जो कि सबसे पहले volatilely उड़ जाती है दिमाग से. पढ़ना एक अलग चीज है, and then उसको solve करना और group की form में solve करना is something very different. Why is it different? Because we have seen in our practice that we used to study, we were students like of 50 strength. So we used to always study in group studies. I think personally, a sane, good, healthy partner helps you boost your own potential. And if the partner is not serious with the same kind of a career that you want to pursue, he might want to be, pulling you behind. So choose your partner very wisely. Start studying at least like 3 months left from the house job, and start going through the text, and with your partner, just solve these entire BCQs and all, and the past papers, so that you know that you are sticking to the right concept. Okay, next slide, please. Okay, so how to study? Very frankly speaking, rectification is not the answer to it. You have to make your concepts, because I belong to medicine. Medicine requires a very, collaborative concepts between pharmacology and pathology and physiology for that matter. So these things, when you know what to do, what is actually happening with the patient, when you have the patient's perspective, the disease perspective in your mind. So here, what you have to do is just make a concept of the pathophysiology in your mind, and look at the clinical picture, what is going on with the patient, so that there is an alliance between the two concepts, and that could help you in, in investigation of the disease and in management of the disease. Don't lose hope. It is going to be a bit tricky. It is going to be a bit boring. It is going to be, once when you fail, then your entire confidence gets shattered. Back when we used to give our part 1s, we used to be people who never had their supplies at all. Like पूरी class के अंदर 5 साल के अंदर शायद कभी कोई किसी की एक आई होगी. तो उस वक्त fail होना used to be like, I don't know, कैसे, जैसे पता नहीं कभी जिंदगी में fail हुए ही नहीं. So अब जो failure होता है ना, that is your best teacher. If you keep on blaming your failure कि मैं इस वजह से नहीं पढ़ पाई, कि मुझे पास टाइम नहीं था, मैं जॉब कर रही थी, या मैं RMO शिप ज्वाइन कर चुकी थी, या मैं घर पे बहुत काम था, blah blah blah, whatever it is, you won't be able to realize that what is actually you're lacking in getting this thing done. There is a certain amount of knowledge that you have to pass for to get through this FCPS 1 thing. But apart from that, you keep on practicing your BCQs, and you keep on revising your concepts with your partner, so that you know that you're on the right track. So if, God forbid, you get failed in the first attempt or so, you'll be able to pinpoint that, okay, this concept was not good, this time was not good, so that this experience might help you in the future, what you actually have to do. Okay, next slide, please. This is again a repetition, please. Okay. So the exam date, the big day. It is conducted 4 times in a year. And right now it's like online and physical and both, maybe somehow. The registration process and the documents should be with you pre-hand. Like whenever you finish your house job, then you have all the documents with you. The paper patterns has like 2 papers, 100 BCQ each, and duration of about like 2 hours. And that is going to tell you your fate, that if you're going to pursue your residency in the near future. Next slide, please. Okay, so after FCPS, the entire story starts after you're done with your FCPS 1. Right now, it's very, very difficult to get residencies in your, in your specialty, whatever you want to pursue. So the candidates of this era might have to do some attachments with the places they would want to pursue their residencies in. Like I am talking about people who are so focused that they know from their undergrads what they actually want to do. For example, if I want to be a nephrologist, I might want to work for about a month or 2 months in maybe SIUT, in maybe kidney center, so that I know the, the disease process. I know the kind of patients, if they're still appealing for me. And more importantly, I know about the people who are handling these things and at a large level. So I have a, interaction with them, and they might be helping you in pursuing your residencies. To find residencies these days is not at all easy. But once you get into it, just stick to the plan that we have to, continue this 4 to 5 year training, and we have to get on with the future plans. Usually it takes 5 years, 4 to 5 years, and then you clear your, maybe not in the, if not in the first attempt, maybe in the second attempt, but you keep on being persistent and you keep on being, upgraded. Like ऐसा ना हो कि आप सिर्फ और सिर्फ रेजिडेंसी कर रहे हो लेकिन आपका जो साइनॉप्सिस है वो ही क्लियर नहीं है, आप सिर्फ रेजिडेंसी करके अपना वो कर रहे हैं, आपका आईएमएम नहीं क्लियर हो रहा है। तो हर चीज को क्लियर करने का, हर चीज को करने का एक वक्त है। अगर हम वो वक्त गुजार देते हैं, जितना डिले आता चला जाता है वो उतना आपको पुल बैक करता रहता है। ठीक है, सो नेक्स्ट स्लाइड प्लीज। Okay, so this is I'm very much sure the people of KMDC are very much familiar with the 2 gentlemen sitting in the front row, and they are our mentors, and I did my residency with them. And apart from like when just after we left our residency, we didn't leave them. Like they have been with us throughout. This is very recent, maybe 2 months back, and we had a meetup. So from that day, from that, the picture I showed you before, from 2008 to this 2022, we have been persistent in continuing education and, practice medicine in future and help our juniors and guide our juniors better so that they can pursue with the same zeal and zest in the future. Next slide, please. Okay, the second part of the presentation was ethics dealing with chronic diseases. It is not very easy to, deal with chronic diseases. You have to be very empathetic with the patient. And with that, I might want to add that you have to, from the training that we got from Abbasi Shaheed Hospital, we had to do a lot for the patients because they were underprivileged patients. They never had anything to their account. And, we had to go beyond our boundaries just because we are not just a PG for them. We are something much, much, much higher because their ailments rest in our hands. We can heal them, So whenever you try to opt for a field that has chronic diseases linked with it, I might want you to, get enlightened towards what are the ethics that are dealing with these chronic diseases. These patients, they have rights. They have rights of confidentiality. They have rights of, if I have 10 patients, I should be, distributing my resources equally, or maybe to someone who deserves it better rather than to waste on someone who does not deserve it at all. And then patients' safety comes first, do no harm come first. And conflict of interest arises when, like, if I want to do a research and I want to do a research with a drug maybe, and I want my research to go really well, but this drug might not be as beneficial or it might be harmful for the patient. So from the very start, I should not be doing this kind of a practice that might hurt my patient's interest. Okay. Ethics of privatization, as we know that we have very less government hospitals practicing here. We have a lot of private hospitals. In private hospitals, there are certain hospitals that are trust-based. So in those, we have two categories of patients, the lesser privileged and the more privileged patients. So our medical knowledge and our medical efforts should not be blinded by this privatization or something like that. Okay, informed consent, you should always tell them what you have in mind and what you actually do with them, so that they have a trust build up with whoever is handling their disease at that point in time. Dealing with the opposite sex, one thing is for sure that doctors have no genders. सही है, कोई फीमेल डॉक्टर और कोई मेल डॉक्टर नहीं होता, डॉक्टर डॉक्टर होता है. डॉक्टर को आपकी डिजीज भी वैसे ही सुननी है, वैसे ही समझनी है और वैसे ही उसको हील करने की कोशिश करनी है जैसे वो शायद दूसरे जेंडर के साथ करेगा. ठीक है. There are certain things जो कि थोड़ी सी ज्यादा sensitive होती हैं, like the beginning or the ending of life. If you want to counsel someone who is about to, you want to counsel the family, the patient is about to die or something, you would want to tell them that we want to give least harm to the patient and we want to have least, aziyat sabse kam honi chahiye mareez ki. So that should be your priority, regardless of the fact that, whatever the amount of money is going to be served or whatever is, you should always do things that are in best interest of your own patient. Next slide, please. Okay, the most awaited part and the most favorite part here. I do want to hear about your research perspective. What do you think that, what is the hindrance in getting researches, and what is the, there's no easy way out. One thing is for sure. There are a lot of myths associated with the research for people who are not very much up to it, like not very much in the field. They think that, anyone can do research, not a big deal. 2-3 journals, books वगैरह पढ़ के research आ ही जाएगी, and all you need is maybe a good hand of SPSS or maybe Excel or stuff like that. And even if the research is not going in their favor, they do. Okay, I am going to come to that. Okay, what is the most important thing is that what they think is that they did their best. Number one thing, to stop all this common myths and to stop all this, to bust it all out, the first thing and the most important thing is you should always be unbiased in all your efforts of research. Number one is, like, when patients come to you, they are already, आजकल Google का ज़माना है, ठीक है? Even if you are going to go to a doctor for your parents or for yourself, maybe, you are going to find out something about the, diseases, and then you're going to talk about diseases to the doctor. Just to be well informed. This is a patient's right. They have to do it. ठीक है? तो, लेकिन to derive your everything from Google is going to tell you what you want to hear. It is going to tell you the most searched thing, and you might be on the wrong track there. So anyone can do research, but it needs skills and it needs experience. Like I tell my juniors that your first research teaches you immensely. जब आप कभी कोई पेपर खुद से लिखते और खुद से उसको सबमिट कराते हैं, तो फिर it keeps on coming back. The journal, जैसे अभी someone mentioned that ERBs are very hard to find. You have to follow your protocols first. ठीक है? अगर protocols आपने सही बना के research भेजती है, and even the ERB or the the journals that you're sending into, they think that there is something wrong with the research, the data is maybe tempered or something is wrong, then they're going to create issues, and then that might, that should not have been there in the first place. Research के लिए books या journals या articles अकेले पढ़ लेना काफी नहीं है. ठीक है? Research के लिए when we were back there, हमारे पास research की workshops हुआ करती थी, अभी भी होती हैं still. और रिसर्च इतनी वॉलेटाइल है, आपको कॉन्सेप्ट ग्रास्प करना आसान है, लेकिन उस कॉन्सेप्ट को अप्लाई करना हर डिफरेंट सिचुएशन में बेसिकली चीज वो मुश्किल है, ठीक है। तो इफ you are in the practice of doing things and you keep on doing it right, तो फिर I don't find any issues with that कि आपका जो वो है वो वापस आता रहेगा। And let me tell you this, frankly, in my experience, internationally पेपर को पब्लिश कराना ज्यादा आसान है बनिस्बत आपके ये जो लोकल पब्लिकेशंस है। नेक्स्ट स्लाइड प्लीज। So the steps of research is, first of all, understand the philosophy behind research. Why do we actually need it? Medicine is a kind of field. Medicine is the oldest field in the history, but it is the kind of field that should always be kept on evolving in future. So this evolution will be brought about by, by the researchers of your era, of my era. So we keep on, हर डेकेड में जो भी डिजीज है उसके अंदर कोई एक नई चीज आती है that might be helpful for the patient, that might be better for the patient, be it maybe cost effective or time duration is important. So हर चीज को मजीद improve करने के लिए you need research behind it. If I want to go with treatment A and somebody else is saying treatment B is better, so I should know a research behind that. Actually, there should be a comparison between these two researches, these two treatments, that which one is actually better. Number two, for the undergrads, find a mentor who is well versed in research. Okay. As a student, you can get your researches published if you start working on with a mentor and just start collecting their data and understand their project in a way that you are able to do a similar project of your own in future. So uske liye you need to have a mentor with you so that you can, during collection of data and during your analysis and during your research writing protocols, they are able to teach you the, the small pros and cons of कि ये चीज ऐसे कर ली होती तो आसान होती, ऐसे कर ली होती तो मुश्किल होती and stuff. The other thing is, our wards and our clinical sites are very well versed with journal clubs, with mortality meetings and stuff. And there you get to find that what are the new things that are happening in the world. And can we, as a third world country, as a developing country, can we apply the same concepts at the same cost here or no? So you get to learn something new when you're sitting in these journal clubs and you're sitting in these mortality meetings or morbidity meetings, and what actually happened with the patient. Can something could have been done better for the patient or no? Sahi hai? Next slide, please. So the other thing is to write case reports. Case reports are something like, if you find a very interesting case, if there's a combination of disease, or if you found something that is going to happen later in life, and then you found like I had a patient with rheumatoid arthritis, and this patient had the least expected and the most last to come complication as the presenting complication. She had scleromalacia perforans and she had no signs of any rheumatoid hand disease or something. And upon inquiring, we just asked her if there is any, any morning stiffness, and then she started pouring in कि हाँ ये इतने अरसे से मुझे जो है वो सुबह में उठ के रोटी गूंदना, आटा गूंदना मुश्किल है, stuff like that. अच्छा, I reported that case, and when I reported that case, I got to search for other cases in the world that are happening, and this is such a rare implication. And then when you start writing a case report, this helps in making a case series. अगर ऐसे ही कोई similar cases हो जाते हैं, आप उसको case series की तरह present कर सकते हैं, या अगर आप इस type के किसी cases पे काम करना शुरू करें तो you can even publish a research with it. Like the latest we are doing is COVID arthritis and COVID uveitis and stuff like that. अच्छा, there are brief communications that are written to the journals. There are epidemiological or retrospective studies. And last but not the least, and as someone pointed out very well, ethical considerations and conflict of interest. These two things should be very, very, very clear from the very start. Ethical considerations has just one point, that your research in no way should harm the subject, the patient, or anyone else for that matter. And the conflict of interest arise if, for example, I belong to maybe, you know, in my practice, I all like, for example, diabetes. If I have my shares in something that is producing insulin, and so your conflict of interest should not be biased. You should not be biased. Someone who would want to promote insulin should not be, you know, publishing research in favor of insulin. We should first have the patient's perspective and the patient's thing in our mind. Okay, next slide, please. Okay, so it's very easy. How easy is it? You just have to observe, like from your third year onwards, if I'm not wrong, you start going on to your medical wards or your surgical wards or any wards for that matter. You just observe the natural course of the disease, that, you know, what is actually happening in the disease. For example, dengue patients. How are they presenting? How are they presenting now? Are they getting complicated? Are they getting, you know, better? Do we have to transfuse them now, or do we not have to transfuse them now? These are the certain things that you have to, you know, observe. After observing, then comes that you have to hypothesize a question. You have to frame a research question that, you know, this thing should be, if I do this thing that way, that might help my patient better. Then what you do, either from your observational study or from your experimental study, you devise a test, and after running that test, you conclude. Okay? Next slide, please. The scientific way is always to ask the question first. What is the question? Is this treatment better, or is that treatment better? Then we do a research about that particular treatment, that what is actually better for the patient. We hypothesize that treatment A is better than treatment B. And then after maybe an observation to just give the treatment, or after an experiment, we analyze the situation, that what actually went with the patient, how many patients had a, you know, mortality benefit, how many patients improved, how many patients did not improve. Even a false hypothesis, if your hypothesis gets cancelled, even that is a result in itself. And then you conclude your presentation, that your, whatever your findings are with that research. Okay, next slide, please. Okay, so it's about thoda sa busy hai, but think about a topic first. If you are an undergrad, maybe if you are associated with a mentor, look at what his research findings are, what is he working on. कुछ लोग डेंगू पे काम कर रहे होंगे, कुछ कोविड पे काम कर रहे होंगे, कुछ अपनी पर्टिकुलर फील्ड्स में, कंजेस्टिव हार्ट फेलियर, एनीथिंग ऑफ दैट सॉर्ट. सर्जरी वाले इस पे काम कर रहे होंगे कि ये वाली तरीके से सर्जरी करना ज्यादा, मरीज ज्यादा बेटर हुआ, या उस तरीके से करने से मरीज ज्यादा बेहतर हुआ. ठीक है, तो you find a mentor and you think about the research question in your mind, that, you know, what is the topic formulation. Then you match the research design to your research objectives. I want to get this thing from this research. I want to know the prevalence of this disease. I want to know the, you know, if I applied this treatment, how many patients got better. So you want to associate it, your research design, to your research objective. Then you define the variables. I am going to be working on this research population. It should be adults, or it should be pediatric, this gender, this comorbid, and, you know, this variable, इतनी एज होगी, ये सेक्स होगा, ये ऐसे होगा. और फिर इसके बाद एक सारे वेरिएबल्स आपने अपने पास लिख लिए. जब वेरिएबल्स अपने पास लिख लिए, फिर उसके बाद आपने एक सैंपल साइज ड्रॉ किया. सैंपल साइज ड्रॉ करना बहुत कोई रॉकेट साइंस नहीं है. जो भी डिजीजेस बहुत ज्यादा कॉमन और प्रेवलेंट है, उनका सैंपल साइज बहुत बड़ा आता है, बिकॉज हमें एक बहुत लार्ज, यू नो, ऑब्जर्वेशन को एक बड़ी पॉपुलेशन के ऊपर हमें इम्प्लीमेंट करना होता है. तो जो रेयर डिजीजेस होती हैं, उनका सैंपल साइज, क्योंकि पेशेंट्स ही कम होते हैं, तो उनका सैंपल साइज नेचुरली छोटा हो जाता है. उसके बाद you develop tools what to do with this kind of a sample size. What tools exactly, that if you want to, you know, just have an observational study, that I am going to observe this ये particular findings, कि ये चीजें किस किस एज पे इस हीमोग्लोबिन लेवल के ऊपर कितनी आई. तो इसमें आपको सिर्फ एक स्नैपशॉट उसी वक्त की स्टडी करनी होती है, कि आपने अभी आपके पास पेशेंट आया, अभी ही आपने डिसाइड किया कि इसकी सारी की सारी जो, यू नो, इन्वेस्टिगेशंस या जो भी कुछ है, वो सारी चीजें आपने लिख ली, और फिर उसके बाद आपने उसी से इन्फ्रेंस ड्राइव कर लिया. कभी कभी हम उनके ऊपर कोई ना कोई एक टेस्ट अप्लाई कर देते हैं. जैसे क्या, कि अगर मैंने इस पर्टिकुलर पेशेंट को ये सेट ऑफ दवाइयां दिया ट्रीटमेंट ए और उसको मैंने ये सेट ऑफ दवाइयां दिया, तो दोनों के जो आउटकम्स हैं उसमें से बेटर आउटकम किसका था। जब आपके पास ये सारा डेटा आ जाता है, देन यू कैरी ऑन विद योर रिसर्च बाय एनालाइजिंग दिस डेटा, बाय स्टोरिंग दिस डेटा एंड कमिंग ऑन टू द कंक्लूजन। व्हेन यू रीच अ कंक्लूजन, देन यू स्टार्ट राइटिंग योर रिसर्च रिपोर्ट। अच्छा, ये सारी चीजें जो यहाँ से लेके यहाँ तक है ना, इसको इस ही डायरेक्शन में आपको करनी है। अगर आप ये कोशिश करें कि नहीं मैं बीच में से कोई तरीका निकालूं कि मैं किसी की रिसर्च, तो वो एक तो बायस्ड है। दूसरी बात एक ये है कि हर रिसर्च पब्लिश नहीं होती। पब्लिश वो रिसर्च होती है, अच्छी रिसर्चेस वो पब्लिश होती हैं जिसके ऊपर शुरू दिन से उसके सारे बायसेस और कंफाउंडर्स को जो है ना आपने कंट्रोल किया हुआ होता है। तो आप आखिर में रिसर्च रिपोर्ट लिखना कोई ऐसी रॉकेट साइंस नहीं है, आप आराम से सारी चीजें साइट करते हुए रिसर्च रिपोर्ट लिख सकते हैं। ठीक है, नेक्स्ट स्लाइड प्लीज। So when you are done with all your efforts in your research and on your your medicine and everything, and you become a consultant, and there's always room for growth, there's always room for improvement, and in improving your research sense, improving your continuous medical education sense. This was a picture taken on the convocation that I was an assistant professor to and taken with my own mentor there, and she was dean medicine, called as a guest in our convocation. And so these kind of things, they boost your that what you actually want to do further. So I think in a nutshell, if I'm going to talk about it, one should be focused, one should be persistent, and one should keep on working towards a better outcome of your own daily life. Like I see patients from the start, and then I teach the undergrads, I teach the postgrads. I'm going to be a supervisor soon, maybe in a month or so. So the point is that if you keep on working towards the betterment of things and keeping all the negative things aside, everything that is going to pull you down, you have to just shut it, just focus on becoming a better doctor, a better teacher, and a better person for that matter. Next slide please. I hope you found this entire exercise productive. You are free to ask any question. This is just a glimpse of my, daily life. Here, I was conducting a research in the COVID era with my students, and presenting these kind of researches, holding medical camps, and mentoring for, the stalls of medicine and stuff, and being a moderator and being a panel expert in education, in research and stuff, and conducting talks, and just spread the knowledge that you have entirely. So I hope you found it a bit productive, and you are free to ask any questions if you wish to. And I think that's about it from my side.
Thank you so much, Dr. Urooj. We have a list of questions.
Please feel free.
Okay, so the first question is, can FCPS Part 1 not be attempted during house job? Does it have to be after you have completed the house job?
Yes, you have to complete your house job first, and you have to give them a certificate of your house job training, and then you proceed on towards an FCPS 1 thing.
All right. Second question is, do both papers, paper 1 and paper 2 of FCPS, get conducted the same day in the span of 2 hours?
Yes, not in the span of 2 hours. It's 2 hours each. For both of them are conducted in the same day. It is some sort like you start off with the paper 1. It is of 2 hours. Then you get a break of maybe half to 1 hour, and then you have the second paper again. So it's something like that. It's in the same day.
Okay. Third question is, what is the easiest research for undergraduates for like our level? Which research should we go for?
There's nothing as easy research, but like I said before, my first research was when I was doing my house job in the psychiatry ward, and Professor Munir Hamirani mentored me, and the I department mentored me for that. And you just have to find a mentor and work on something that is doable in that span of time. Look what happens here. Research is a very time consuming thing, and when the time gets थोड़ा सा बढ़ता चला जाता है, इंटरेस्ट भी लूज होता जाता है, थोड़ा सा नेगेटिविटी आती चली जाती है, एंड समहाउ आपका जो रिसर्च प्रोजेक्ट है वो कहीं वे बिहाइंड चला जाता है. तो जब भी आप कोई भी डिपार्टमेंट ज्वाइन करते हैं, आई वुड आस्क ऑल ऑफ these students who are doing their final years and who are going to be doing their house job, whichever department you start to join, just have a mentor in mind that I am going to be conducting one research at least in these 6 months with this particular mentor. कोई भी रिसर्च क्वेश्चन या तो अगर उनके दिमाग में है या आपके दिमाग में है, इज गो ऑन विद इट, लाइक उनसे डिस्कस करें कि हम इस बारे में काम कर सकते हैं कि नहीं कर सकते हैं. एंड द अदर थिंग इज दैट इट शुड बी डूएबल. कोई अगर आपने डिजीज को अभी देखना है और फिर उस डिजीज को 5 साल बाद देखना है, वो चीज भी हो सकती है, लेकिन मैं एडवाइस ये नहीं करूंगी कि जो स्टूडेंट्स अंडर ग्रेड के हैं उनको इतनी लॉन्ग रिसर्चेस करनी चाहिए. तो स्टार्ट ऑफ विद द क्वालिटेटिव रिसर्च मतलब ऑब्जर्वेशनल स्टडीज. कि मेरी ऑब्जर्वेशन है कि जी डेंगू के पेशेंट्स में आजकल ब्लीडिंग कम आ रही है, दिस कैन बी एन ऑब्जर्वेशनल स्टडी. तो मैं सारे डेंगू के सेट्स के अंदर लेके और फिर उसके बाद उसमें देखूंगी कितने लोग ब्लीड करते हुए आए, कितने लोगों को ब्लीडिंग नहीं हुई. तो जो भी चीज अक्वायरेबल है इन इस 3 to 6 months के ब्रैकेट के अंदर, वो चीज करनी चाहिए.
All right. Next question is, what is the best field for family-oriented females?
Best field for family-oriented females. See, that the competition is very tough now. Family-oriented females, I want every female, every male, like I said before, doctors have no genders, okay? They can to be doing something. The thing that I've noticed in my practice is family medicine, the basic sciences, the teaching side, everything needs input and everything needs people there. So I think अगर वो टीचिंग साइड पे जाती हैं, थोड़ी बहुत 8 to 2, 8 to 3, 8 to 4 वाली जॉब्स होती हैं, तो मॉर्निंग टाइम के बाद वो अपनी फैमिली को इनफ टाइम दे सकती हैं. घर पे जाके ना कोई फोन बजता है, क्लिनिकल साइड नहीं होती है, या पेशेंट की लाइफ इस चीज से एसोसिएटेड नहीं होती, तो फिर कोई इमरजेंसी नहीं होती. लेकिन अगर कोई इमरजेंसी है तो डेफिनेटली इट्स आवर it's our duty to respond to the emergency calls for that. तो उसके लिए मेरे ख्याल में जो बेसिक साइंसेस है और जो फैमिली मेडिसिन है, इस तरीके की फील्ड्स को मेरे ख्याल में ज्यादा. कुछ लोग ये भी कहते हैं कि ENT एंड आई आर सपोज टू बी दोस फील्ड्स, इसके अंदर बहुत ज्यादा नाइट्स वगैरह नहीं होती, लेकिन आई पर्सनली थिंक कि लाइफ को डिफिकल्ट नहीं होना चाहिए. ठीक है, इफ यू आर एबल टू डू थिंग्स, तो आप ऐसे भी काम ENT में बहुत कर सकते हैं जो कि टाइम कंज्यूमिंग भी है और आपकी एफर्ट कंज्यूमिंग भी है. तो आइडियली क्लिनिकल साइड से दूर होना चाहिए और थोड़ा सा बेसिक साइड की तरफ होनी चाहिए. हमारी टीचिंग के लिए बहुत अच्छे ब्रेन्स की जरूरत है.
All right. Next question is, how is the work-life balance in your field?
Work-life balance in your field, a very good question, by the way. I'm not too sure if I'm the best one to answer this, but after I cleared my FCPS in 2015 end, 16 start maybe, so it's like maybe 6 years. So 6 years and 4 hospitals and 1 teaching institute, countless phone calls, countless patients, a family life, a huge khandan, and with that, your vacations and stuff. So it takes effort. It's not easy, but you have to have your family, and your patients in a very, there's a very fine line when you can go overboard with both of them. So you have to just identify that fine line and stick to it. Make your life and the people associated with you, their life easy. Okay, so they are going to wake you up. They are going to, you won't have a proper night's sleep and stuff, but your routine should be very healthy. You should at least take out maybe 15 days out for yourself in the entire year where the phone is not ringing at all. For people who know me, I have quite a social life. So I think you have to strike that balance. And you have to strike that balance by taking into account what is your priority. My priority, if you ask me directly, is going to be my family and my patients. My family means my closest family. Then after that, after my patients, then comes, you know, the extended family and the friends and the everything. Even the students are part of your life when you are in the teaching field or something. So it is difficult, but it's not like something that is not doable.
Okay. Next question is, despite all that you have achieved, can you talk about some of the struggles in your career that you had to face because you were married?
Bacha, I got married in my 4th year MBBS. So 4th year, final year, house job, your entire training, even your consultancy. From that point, from 2007 till date, uh, it is a constant struggle because you have to strike that balance that I just mentioned right now. And with that balance, like my mom always used to say one thing that, you know, it's you who have to put the effort because you want this career. Uh, your mashallah, I'm blessed with my in-laws that they are all very educated and very, you know, helpful with me. But the point is that you don't, you know, जब कभी भी कोई काम है, कुछ भी ऐसा है, तो उसमें you have to give in your efforts. Your effort, you don't take their efforts for granted. ठीक है कि मैं अभी थक के नाइट करके आई हूँ तो नहीं, मैं घर पे कुछ नहीं है फलाना. This does not happen. So आपकी efforts ज्यादा लगती हैं, struggle zyada hota hai. There are bad days, there are very good days, but in the end, if you strike that balance, if you tell them your boundaries and you accept their boundaries as well, चीजें दोनों तरफ से जो है ना वो towards a positive side होनी चाहिए. सही है? So if you are going on towards a positive side, if you both want to make this happen, like I am a consultant, but I am one consultant for myself, and then second comes for maybe my husband, my mother, and then the rest. लेकिन बाकी के जो लोग हैं उनका मेरे कंसल्टेंट बनने में कोई बहुत ज्यादा very frankly बहुत इंटरेस्ट नहीं होगा. सही है? So what you have to do is that you have to strike that balance कि आपको जितनी एफर्ट आप बाहर दे रही थी शायद उससे ज्यादा एफर्ट स्टार्ट में आपको घर में देनी होगी. एक थोड़ा सा बैलेंस क्रिएट हो जाए, फिर उसके बाद स्टार्ट एक्सपेक्टिंग कि चीजें नॉर्मल की तरफ होंगी. अगर शुरुआत से ही आपका स्ट्रगल, आपकी एफर्ट्स कम है और आपकी एक्सपेक्टेशन ज्यादा है, तो फिर उसके बाद थोड़ा बैलेंस स्ट्राइक करना मुश्किल बात है. I hope that answers it.
Yes, truly. Next question is it true that it's more difficult to find a residency as a married woman?
Yes. See, what happens is that people who would want to take a resident in want to take, I'll be frank here, they want to have a fully functioning working machine with them. Sahi hai? So the bachelor males, maybe, I am not a gender biased person for that matter, but the bachelor males might be a better choice so that because, you know, unki itni liabilities nahi hai. Sahi hai? They want to earn for their family, they'll be very focused, they'll be very hardworking. Somehow ऐसा वैसे हमारे वार्ड में नहीं था. We had a huge you know female there, female number of residents there, but थोड़े बहुत चीजें, शादी, प्रेगनेंसीज, कुछ कुछ चीजों पे एक थोड़ा सा बैकफुट करके अपनी तरफ, अपनी फैमिली की तरफ देना पड़ता है. तो नेचुरली इट पुट्स यू नो अ बैड मार्क ऑन देम. ऐसा होना नहीं चाहिए, ऐसा बिल्कुल भी नहीं होना चाहिए. बट चॉइस में अगर देखा जाए तो इंस्टीट्यूट की चॉइस होती है ऐसा रेजिडेंट जो कि बिल्कुल सिर्फ मशीन हो, उसकी कोई लाइफ ना हो. ऐसा अनफॉर्चुनेटली होता नहीं है और फीमेल्स के साथ ऐसा बहुत कम होता है, इसलिए.
Well, that's a very harsh reality.
But it is, yeah. Can't do anything about it. हमें ये करना होता है as females, we have to work harder work more professional, just to prove ourselves that no, if you are thinking that I'm going to take off because just my, I am feeling low, or, something in my family, you have to strike a very good balance. Like I tell my residents where I'm working right now, if you give, like, मेरा कोई fellow resident है जो कि शायद बीमार है, कुछ ऐसा है, if I work on his regard as well, मैं ज्यादा उसके लिए काम करूं, आगे जाके शायद अगर मुझे जरूरत हो तो फिर वो खुद से आके मेरे लिए काम करना शुरू कर दे. Getting my point? So आपको जो है ना एक step ahead of the game रहना पड़ता है to prove yourself that you are here to work for your patients and you are a professional in any way.
All right. So the next question is, what is the value of doing electives at undergraduate level? Does it affect residency or our CV in any way?
Yes, a good elective from a good institute where the training is very monitored and stuff. ऐसी जगह से इलेक्टिव करना आपकी सीवी के लिए भी अच्छा है. जब मैं चूज कर रही होंगी ना कि मुझे कौन सा रेजिडेंट चाहिए, अगर मैं फर्स्ट करूँ मैं किसी कार्डियोलॉजी सेटअप में से हूँ, तो इफ आई सी अ सीवी जिसके अंदर ऑलरेडी ये मेंशन्ड हो कि एनआईसीवीडी में या किसी हार्ट इंस्टीट्यूट में बाहर से कहीं से भी पहले से काम हुआ है, तो आई वुड नो दैट दिस पर्टिकुलर पर्सन इज वेरी फोकस्ड. आई वुड नो दैट दिस पर्टिकुलर पर्सन इज वेल वर्स्ड. ही वोंट बी लाइक, उसको बहुत ज्यादा मेहनत नहीं करनी पड़ेगी मेरे इंस्टीट्यूट में सेटल होने के लिए, तो डेफिनेटली हम उसको एक टिक ऑफ ज्यादा देंगे. सही है. तो इलेक्टिव्स. दूसरी चीज, ये तो चीज हो गई कि आपको चूज करने में आसानी होती है. आपकी अपनी चॉइसेस आपके अपने दिमाग में बहुत ज्यादा अच्छी आसान हो जाती है. आई डिड माई एंडोक्राइन इलेक्टिव्स फ्रॉम आगा खान. Still date, I know how to manage, and those kind of concepts and those kind of training still stuck in my mind. So ये चीजें आपके आगे की प्रैक्टिस में भी बहुत, आप आगे की प्रैक्टिस वही करते हैं जो आपने पीछे पेशेंट्स देखे हुए होते हैं. तो आप अगर अच्छी जगह के पेशेंट्स देखे हुए होंगे तो डेफिनेटली वो आगे जाके आपकी प्रैक्टिस के लिए हेल्पफुल रहेगा. Any more questions?
Thank you so much, Dr. Urooj. That's it. That's from the questions. If anyone wants to ask any other question, please let us know.
Feel free.
It was an honor for us to have you on board with us today. And especially for me, because for me, it was a very coincidence that only a couple of days back, I composed your interview. And then just yesterday, Eliza asked me to host this webinar. It was quite amazing for me.
I enjoyed my time. So I'm the person who is honored here. So I enjoyed it completely.
Okay, Dr. Ruth, there is another question.
Send it to via any portal or that matter. And I would like to take the opportunity to thank the KMDC alumni for one, and Bushra for her countless efforts towards making this possible. Apart from that, the KMDC alumni is working very hard for the future of the young blood. So I'd like to, thank everyone. And I'd like to acknowledge all their efforts. So because we got this knowledge from our seniors, and to contribute in the same way, it feels very nice.
Thank you, Dr. Urooj. We have a couple of more questions, if you don't mind asking.
No, not at all.
Is there any link between major wards and your path to residency? What if you don't know what you are going to specialize in and choose the wrong one in house job?
That is a rare occurrence, but I have seen that happening. There are people who did maybe 2 or 3 FCPS1 in a specialty, could not clear. Then they switched on of specialty, could not clear. And in the 7th or 8th attempt, maybe they cleared the specialty of their own. The other, I found 1 or 2 residents who started working in gynecology, but somehow they felt like it's not their field, and then they switched on towards medicine. That does happen, but it's very rare. Why rare? Because I consider the students of this generation to be more aware and more aware of what they actually want. सही है? तो I'm sorry. So the point is that whenever this is where the electives come in. If you get the हम जब पढ़ते हैं ना third year fourth year में final year तो almost हमारे words start हो जाते हैं, लेकिन we know the theoretical side of whatever is appealing and charming and stuff for us, but when we actually get on to the wards, इसीलिए जो अब के बच्चे हैं उनको wards के अंदर electives में ज्यादा time spend करना चाहिए so that they actually know which field is worth waking up 6 a.m. in the morning every day for the rest of your 30 years of life. So if you find that kind of a field, this work for you is going to be so fun. Like every day I wake up, I'm like, okay, fine, I have to see patients, I have to teach and I have to do stuff. Lekin agar koi field aapne aisi choose kar li, it's not fun waking up to, then it's like you're stuck in a bad relationship for the rest of your life.
So which institutes or which hospitals do you recommend us for electives? Because third year, fourth year, and final year, they especially are very confused where to go and which hospital to approach for electives.
There are 3 or 4 very state-of-the-art hospitals here in Karachi. Number 1, AKU. Number 2, NICVD. Number 3, Indus Hospital. Number 4, SIUT. Number 5, even civil hospitals के कुछ wards हैं जिनको हम वैसे बता सकते हैं, जिनके अंदर जो आपके mentors हैं ना, the consultant should be very much encouraging towards these people coming in. अगर थोड़ा बहुत भी आपके consultants का interest होता है ना towards these students, they make their life beautiful. लेकिन अगर आप किसी ऐसे इंस्टीट्यूट में चले जाओ, they don't care कि whoever is attending their time, and then it's a waste of time, and that should not happen. So these 4, 5, 6 institutes, they should always go for it. Whenever you find free time, be a research associate, maybe in AKU or Indus Hospital. Everyone these days needs a research associate. By that, you would know what to do with your researches as well, and how to polish your own research, because research is a thing that you have to do any case. भले आप कुछ भी बन रहे हो आगे जाके.
If someone is interested in, if someone even in fourth year, third year, final year knows.
But I can't hear you very nicely.
Am I audible?
Yes, you are. Yes, you are.
So what if a student of third year, fourth, or final year knows that they have to go into a specific field? Should they still go for SIUT even if they are not interested in the nephro, or they should go to NICVD even if they are not into cardio?
They should go to NICVD or the nephrology thing, SIUT, if they're not getting the electives in their respective field department. Like, SIUT, NICVD these days, it's not just a hub of one center, one thing. They have multiple diseases, multiple consultants working under the same roof. Nephrology also has a gastroenterology department. They also have a infectious disease department. They also have surgeries going on for the urology side. So, it's a mix of things. दूसरी चीज बेटा, कभी भी सीखा हुआ इल्म जो होता है ना, वो जाया नहीं होता. तो आप कुछ भी नेफ्रोलॉजिकल साइड से करेंगे या सीख लेंगे, आपको फर्स्ट करें कार्डियोलॉजी में जाना है, तो आपकी ये इंसान है ना, तो हमारी हर डिजीज जो है, एक ऑर्गन की डिजीज खराब होते हुए दूसरे ऑर्गन पे अप्लाई जरूर होती है. सो व्हाट वी हैव टू डू इज दैट हमें उस कॉन्सेप्ट को जो हमने यहाँ सीखा, हम यहाँ पे आके अप्लाई कर सकते हैं. उसके अलावा जब आप पार्ट 1 क्लियर करते हैं ना, तो आप पार्ट 1 क्लियर करते हैं जनरल मेडिसिन के अंदर, फिर उसके बाद आप स्पेशलिटीज की तरफ मूव करते हैं. तो दैट जनरल मेडिसिन थिंग, इट माइट हेल्प यू, जो आपकी अदर डिजीज की और जो अदर फील्ड्स के पर्सपेक्टिव है, वो आपकी जनरल मेडिसिन को इम्प्रूव कर सकते हैं.
Okay, can you please tell which wards are good in the civil hospital?
Civil hospital, Professor Shaheen Bhatti, he was my examiner in my CPS part 2. So her ward, I'm not too sure right now if it's the medical unit 2 or medical unit 3, but that ward is the best. Because the teaching environment there is very nice. Hello?
Okay. just the last question now. What are other options to come into research career other than FCPS?
Okay, you don't need to have FCPS for your research career. Even in your research, like if someone is doing maybe biochemistry and maybe pathology, they can do research. Like they need uh, researchers for their own fields. Research associates. So you can do research in any field possible, even in social sciences, even in community medicine, in any field that you can do researches, and there is always a post of a researcher there. So it's not important that you just FCPS needs a researcher. Every field needs a researcher.
Can you please tell what is a research associate?
Research associate is basically a MBBS passed student who is going to be aspiring a career maybe in teaching or maybe in clinical side, but wants to polish their researches with a mentor. So if you find any mentor and he can make you his research assistant, so you can collect the data and analyze with him and write down the research writing with him, and then you can, in both collaboration, you can publish a paper. So you can be a research associate with almost anyone possible.
So can an undergraduate student be a research associate, or does it have to be? Okay.
You can be a research associate at a good, if you know how to handle SPSS, if you know how to handle, you've had these basic workshops and you have this basic knowledge about the community medicine department, you can easily be a research assistant with anyone. A couple of my students right now are research assistants at AKUH.
Okay, all right. What do you think about the courses that many hospitals offer, such as AKU offers many courses to undergraduate students, and even in the DCPE department also offers many courses. So are they valuable for us, for our CV, for residency, and in further in the profession?
I just mentioned before that किसी भी किस्म का इल्म कभी जाया नहीं होता. सही है. So any kind of courses, rather than regardless of rather than waiting on for something and wasting your time, why not do a small thing? जो भी अगर आप कोई course की form में कर रहे थे, for example आप BLS courses कर लें, आप ACLS courses कर लें, आप साथ में कोई उसको conduct कराने के courses कर लें, आप higher medical education के health professional education के उसके कोर्सेज कर लीजिए, SPSS में रिसर्च के कोर्सेज कर ले. दिस इज ऑल गोइंग टू पॉलिश यू बिकमिंग अ बेटर फिजिशियन एंड अ बेटर टीचर इन द फ्यूचर. तो ये किसी भी किस्म की कोई, जैसे आज स्मॉल कोर्स कोई गैस्ट्रोएंटरोलॉजी का आ गया, कोई स्मॉल कोर्स ECG या इसकी इंटरप्रिटेशन का आ गया, तो एवरी काइंड ऑफ नॉलेज इज गोइंग टू हेल्प यू इन द फ्यूचर. So rather than just wasting your time or waiting on for something, why not acquire that?
Right. So like you said, every organ, एक organ दूसरे organ से connect हो जाता है.
Exactly.
So nothing wastes.
In our COVID era, when there was a lockdown, I did maybe 13 or something courses online from AKU portal. They used to send this COVID के अंदर even PPE की preparation, PPE पहनना, masking, इसकी छोटे छोटे small courses थे 1-2 hours के. So we used to do that. अभी critical care का कोई course हो गया, तो even every medical student, we want to be doctors in future. So हमें अभी से अपनी प्रैक्टिस को जो है ना वो बिल्कुल डायरेक्टेड रखना चाहिए उसके लिए. तो किसी भी किस्म की नॉलेज इज गुड नॉलेज फॉर अस.
Okay, and lastly, does research assistant come in authorship?
See, authorship is something that you and your mentor should decide. Ideally, every person who has, there is a authorship का ना एक defined क्राइटेरिया होता है. सिर्फ इतना छोटा सा काम कर देने से आप ऑथरशिप में नहीं आते. आपको वो चारों क्राइटेरियाज को, जिसके अंदर आपने हाउ टू डिजाइन इट, मैन्युस्क्रिप्ट राइटिंग, एक्वायरिंग डेटा एंड मैन्युस्क्रिप्ट रिव्यूइंग, इन सब के अंदर थोड़ा थोड़ा रोल प्ले करना होता है टू बिकम एन ऑथर. अ स्टूडेंट कैन वेरी वेल बी एन ऑथर. आई हैव मल्टीपल रिसर्चेस विद माय ओन स्टूडेंट्स, एंड उसके अंदर फिर सिर्फ ऊपर नीचे का फर्क ये होता है अगर फर्स्ट करो 5 स्टूडेंट्स का ग्रुप है, उसमें से 2 of them are very very active, so definitely they should have a higher number rather than the other ones. अच्छा, ये जो numbers है ना, इनकी अपनी एक वो होती है, एक strength होती है. जो फर्स्ट ऑथर होता है, जो कॉरेस्पॉन्डिंग ऑथर होता है, यानी कि जो जर्नल से कॉरेस्पॉन्ड कर रहा होता है, या जो फर्स्ट 6 ऑथर्स होते हैं उनके पॉइंट्स होते हैं. इसके बाद भी ऑथर्स आ सकते हैं, लेकिन उनके उतने अच्छे पॉइंट्स नहीं होते, बिकॉज नेचुरली उन्होंने रिसर्च के अंदर उतना पार्ट प्ले नहीं किया हुआ होता. तो स्टूडेंट्स कैन वेरी वेल कम इन आवर ऑथरशिप.
All right. Thank you so much, Dr. Urooj. I request Dr. Sahrish to please take over from here. She is from KMDC Alumni Committee.
On the behalf of KMDC Alumni Working Committee, I would like to thank Dr. Urooj for this wonderful session and for taking your time out from your very busy schedule. Urooj, it was really wonderful to hear you again. And
Lovely to hear your voice, Sahrish.
It was wonderful. And Dr. Urooj was not only an inspiration now for our students, she was an inspiration when we were in college. She was an inspiration to her class fellows and for her seniors and juniors as well. And she's the most hard-working person I have ever seen in my life. Somebody has asked that what were the struggles, how have you managed the married and professional life, and I would like you to know that it's really it's not something very easy, like she have said, because I have seen that struggles. Because when we were doing the house job, I was unmarried and I go after the 30 hours a night, and I go to sleep for 14 hours, and Urooj went home and she did all the housework and everything. So it's difficult, but if you do that, and if you do it with the passion she had, you can be where she is now. She's an inspiration for all of us, and I hope that all of you students have gained something today. Urooj, it's a pleasure to have you, and it's very very nice that you have taken your time out from your extremely busy schedule. Thank you so much.
Anything for you.
Okay, thank you. Okay, thank you. It's all for today. I hope that you will join us for the next session in upcoming weeks. For the next, we are trying to get somebody else for the career counseling sessions. I hope you will join us again, students. Okay, thank you so much.
If I'm required again, I'll be happy, more than happy to come again.
We will ask you to join us again and again. You are a valuable asset for all of us. Okay, thank you so much.
Allah Hafiz. Signing off. Allah Hafiz.